for coming today. We are very proud to present our distinguished guests today, and we're very proud that you took the days at the time of your day. We know you're all very busy to be with us here today. I would like to welcome you all, and on behalf of Child Early Intervention Medical Center, Child Learning and Enrichment Medical Center, and Maharat Learning Center, I would like to say thank you, and I would like to say also thank you for our guests tonight. Let's Connect Professional is a new initiative by Child Early Intervention Medical Center that is hoping to raise awareness, share the knowledge with experts in the professional pediatric community, and hopefully engage the public and the community of experts around UAE. Who we are a group of medical and education centers that are dedicated to providing services, rehabilitation, and the tutoring of students or children with developmental delays, learning difficulties, and autism spectrum disorders. We started in 2008, and in 2010 we were preparing children for schools, and we found that we needed to work more with schools in order to make more children access the mainstream education. So in 2017, we started Maharat Learning Center as an educational arm where we support the student with school support services. This includes shadow teachers, helping the teachers with the training, with the IEP plan, behavior support plan, and hopefully see these children functional and successful in mainstream education. We also have developed our own academy for those who cannot manage to access schools, where we also teach them. We have the British curriculum combined with the ASDAN life skills and the STEM, science, technology, engineering, art, and math program to enable them to achieve high level of academics so that they can lead an independent life. Today, I have the pleasure to introduce you to our panel. Dr. Hussein Ali Al-Masih is a social care expert in the Community Development Authority in Dubai. He holds PhD from Forest Institute of Professional Psychology in Springfield from Missouri, USA. He had masters from Radford University, Virginia, and he did his pre-doctoral internship at Florida Institute of Neurologic Rehabilitation in Florida. I would like to welcome Dr. Hussein to our panel and thank him for all his support to all the children he knows that are affected with autism or with developmental delays. My second guest is Dr. Hiba Atiyah, the Director of Human Rights Monitoring and Complaint from the Community Development Authority. She holds PhD in speech pathology with a minor in learning disability from Howard University. She had her master's from Boston University, and she is an ASHA certified speech and language pathologist. She worked as a director for the Diagnostic and Early Intervention Center in the Ministry of Education in Kingdom of Saudi Arabia, and she was a consultant speech and language in King Faisal Specialist Hospital and Research Center. Today, she is the Director of Human Rights Monitoring Complaint in Community Development Authority. Thank you very much for joining us today. Ms. Nicole Campbell has a Bachelor in Science in Social Psychology and Master's in Applied Behavioral Analysis from the University of Ulster in Cloraine. She has received her board certification, behavioral analysis certification in 2016, and she has over 14 years of experience treating autism and developmental delays. Nicole O'Reilly, she is an occupational therapist with bachelor's from Trinity College in Dublin. She obtained her postgraduate certification in sensory integration at Ulster University and currently a member of the Royal College of Occupational Therapists and Sensory Integration Network in the United Kingdom and Ireland. Dr. Fiona Dizera is the Clinical Director and Head of Psychology and Research Center at Child Early Intervention Medical Center. She had obtained her doctorate in clinical psychology at the University of Teesside and postgraduate certificate in primary mental health care and master's in health psychology. She has been providing autism diagnostic services for more than 10 years. So please welcome with me our guest panel. If you join slideview.com and you put hashtag, you can post your questions and we will see them, and we'll see if we can also answer your questions at the end of the panel. My first question is for Dr. Hiba. I'll start with you. We have done a study a few years back, and it showed 87% of the parents did not know the rights of their children and did not know if there is any law or regulation to protect their children's rights. We would like you to please elaborate what are the rights of special children or people of determination, as it's your role in the Community Development Authority.
First of all, thank you for having me. It's always a pleasure to participate in your events, Dr. Hiba. Maybe you don't know, me and Hiba go back from schools in high school. We were together. So, yeah, we're in Riyadh school.
10 years ago.
Yeah. It's 8 and a half. Okay, about the rights. Of course, let me start with the international treaties that United Arab Emirates have ratified in 2009, which is on the Convention of Protection for People with Disabilities, which really was the beginning of realizing that the people with disabilities has their rights, and we want to start working towards ensuring that they have all the rights like other developed countries. It came until 2013 when I came, law number 2 has approved in Emirates of Dubai, and the law is really comprehensive, that has all the rights for people with disabilities, including children and adults, which making sure that they have the very important issues that is concerning these categories, like accessible environments, rights in education, rights in health, rights in social services. Also, the law goes into how the complaint system, if the people with disability don't get their rights, where to go and how to file complaints, and also into if there is like cases of abuse or neglects, where to go and how to go about cases like this. Also, there is Article number 5, which is really more specific for Community Development Authority as the entity in Dubai government, which is responsible of ensuring the practice of the law and ensuring the rights of people with disability within Emirates of Dubai. I'm talking about Emirates of Dubai now. It dictates or it mandates that Community Development Authority ensures rehabilitation programs, outcome accredited programs, places where people don't have accommodations, ensuring that social services is there. So many, you can see it in on the online law number 2, and I urge people and parents really to read the law, and they know their so they know their rights. The law is protected and the rights is protected. We are working in Community Development Authority to ensure that we apply all the items of the law. We went into many programs, maybe later on we can talk about it, to ensure the rights of people with disability within the Emirates is protected.
Thank you very much. Dr. Hussein, my question is about early intervention. You have been assessing children in Dubai for the last probably more than 10 years, probably last 14 years. And we would like, today's theme is about best practice in early intervention. So in your opinion, what would be the best practice for early intervention?
Bismillah ar-Rahman ar-Rahim. Thank you for having us here today, and it's always a pleasure to connect with people and professionals and to have this opportunity to kind of convey some needed information in the community for professionals and for families. To answer this question, I think we need to talk about two different things. First, the Ministry of Community Development, which used to be Ministry of Social Affairs, is currently embarking on developing standards for early intervention programs in United Arab Emirates. As you all may very well be aware, that there are many early intervention centers that have been popping up in the community in different Emirates, Sharjah being the pioneers in early intervention in the United Arab Emirates. But a lot of these centers have adopted different models of intervention, and there were no unifying approach to implementing these interventions. So the Ministry of Community Development has taken upon itself to develop these standards, and they, as far as I know, they are still working on it, and they're consulting different professionals in the community. Now that's one thing. The other thing is that in Dubai, the government of Dubai have launched an early intervention program in 2009 based on the best practices that we were exposed to those years. The government of Dubai launched sort of research into what would be the best practice in early intervention, because there was a gap during that time. That study was in 2006, and if anybody remembers, there was a program called Takamul. Takamul was a government initiative to fill the gaps in the services of disability in Dubai. Within that initiative, there was an early intervention program that adopted more of a social model of early intervention. Basically, what we mean about social model is that the family is the center of the service for evaluation and intervention. And also the model adopts more of a natural environment approach, where the assessment and the intervention happens in the child's natural environment, that being the house, the mall, the park, or even the school. So therapists basically develop sort of an intervention plan and assessment in the child's natural environment. So that's another criteria in the best practice. The third criteria in the best practice is routine-based intervention. What that means is that all the interventions are implemented in the child's daily routine. So we're not confining the intervention in a session or a 1 hour intervention in an office. Basically, the interventionist, with the work with the family, try to implement the goals of intervention in the child's daily routine. So while he's having his breakfast, while he's playing, while he's changing his clothes, whatever the child is doing during the day, and the family is involved with the child, intervention is an ongoing. One of the best criteria for early intervention is intensity. If we can summarize the best practices in early intervention, I can say there are two things: three things: family intervention or family-based, intensity of intervention, and natural environment. The intensity of interventions basically mean that intervention should be 24/7. The more services the child has, the better the outcome is going to be. So the Community Development Authority's Early Intervention Program basically adopts that approach approach. We work with the family, natural environment, daily routine, and as much as possible, we try to have an inclusive environment for the child. And inclusion includes also the social inclusion and educational inclusion. We try to have the children to be in a kind of in a school setting as early as nurseries. Unfortunately, what we found out that a lot of children are placed in an inclusive environment later in their age, where that becomes problematic for the child. They have difficulty being incorporated in a school setting at a later age. So we always encourage that inclusion should start in very early age. As soon as the child is able to go to nursery, that kind of helps the family also to kind of play a role in helping the child in the inclusion of academic settings.
Thank you very much. Dr. Fiona, many parents are told their children needs assessment by school or by some friends or by someone or their pediatrician. And when they go to the psychologist, they don't know which assessment they want or what they need. Can you please share with us what is the best practice in assessing children with developmental delays, and when it is the best time to do it? Do we wait until they are 3 years of age, or when some certain things happen and this is when you think that the assessment is needed?
Yeah. So I think that it's a very confusing time for parents when they're asked to go for an assessment. Often they don't really know what that means, and I think sometimes it's quite disempowering for parents because they're told that their child needs an assessment, and sometimes school placements can be contingent on their child having an assessment, and I think often parents don't feel that they are given a lot of choice or that they're really involved in the process. So I think the first thing that we have to do as professionals is make sure that parents are aware of the fact that they are a really important part of that process, and that starts from the very beginning when we're educating the parents about what does it actually mean to have an assessment. Assessment, it has to be bespoke. It has to be around exactly what the child needs. So it needs to be individual to that child. It needs to be with a clear purpose. What are we doing an assessment for? What is it going to do to benefit that child? Because doing an assessment just to yield a diagnosis is not particularly helpful. The name of it isn't always helpful. It's what we're going to do next that's the most helpful thing. In terms of best practice for assessment, it's quite difficult because there is no one global guideline of what is the best practice for assessment. So if we're thinking about autism spectrum disorder, there's many, many different best practice guidelines. So if we're thinking just about the US, it's state-specific what their best practice guidelines are, which is really confusing because we're all assessing for autism, so we should all be doing the same thing. And here in the UAE, there are no clear best practice guidelines that we should be following. So I think different centres will follow different guidelines. So at Child Early Intervention Medical Centre, we follow the NICE guidelines, which are the British best practice guidelines. But the British best practice guidelines are developed for a certain service delivery model that isn't necessarily one that's available all over the world. So we have to kind of, work within the confines of the system that we're working in. But I think the kind of most important things when we're thinking about assessment is that it needs to be very, very much client-centered. So what are the needs of the child? The assessment tools that we would be using will be based on the age of the child, the needs of the assessment, and exactly what we're looking at. So if we're looking at a young child sort of below 3 years old, we're looking at developmental assessments that will be looking at cognitive skills, motor skills, speech and language, everyday life skills. And as children get older, we're looking more at cognitive skills, maybe we're looking at academic skills. And we know that depending on the kind of presenting problem that we're looking at or the potential difficulty, there are certain assessment tools that are kind of the gold standard assessment tools. So we've been talking about ADOS quite a lot today, which is a gold standard assessment for assessing children for autism spectrum disorder. But if we're not looking at ASD, we're not going to be looking for things like ADOS. We'll be looking at lots of different tools. So I think what we want to do as kind of standard best practice assessment is we want to make sure families are involved. And as we'd mentioned, we want to make sure that assessments are naturalistic. So yes, we will be doing assessments in a centre or in a school that are standardised tools, but that is not the real world for these children. And very often the child will perform very differently one-to-one with an adult than they would do in their classroom or at home. So as much as possible, we definitely want to be doing observations in school, if possible observations at home or in the community, so so we're getting a really good idea of exactly what's happening. I often hear from parents that they took their child to see a professional when they were 2.5 and they were told come back when they're older, particularly boys. I hear that a lot about boys. Parents are told give them time, they just need time. Boys develop slower than girls, and so we often then see the child coming back at 4 or 5, and actually that window for really early intervention has been missed because parents have been told to wait. So I think the kind of best practice guidelines would say that we need to be doing assessments as early as possible. So as soon as people have any concerns about a child's development, we should be referring them to professionals. And I think we also need to be very aware that sometimes an assessment is a discrete piece of work, but sometimes an assessment is an ongoing process. It's a dynamic process throughout therapies and throughout interventions. So we're not just assessing and that's the end of it. We're assessing as we're working with that child, and we're continuing to monitor progress. We want our assessments to be very clear with their goals. So, as I said earlier, a diagnosis is not necessarily the most important thing. So an assessment needs to yield recommendations, which are what are we now going to do with the assessment. So if a school refers for an assessment, we want to be able to give really clear advice to that school and those parents about, okay, this is what we've seen, these are the child's strengths and their difficulties, and this is how we're going to now use the information to benefit that child moving forward.
Thank you very much, Dr. Fiona. Nicole, I have to ask you, what's your name? She asked me before. Ask me what's my name. You are a behavior analyst, and ABA therapy today is one of the most common practice for intensive programs, especially with autism. Research shows a lot of good results for over 60 years now. Yeah. I would like you to share your experience when it comes to ABA therapy. When it is the right time, what is the intensity, what is the best practice when it comes to behavioral intervention programs?
Yeah, well, going back to what everybody spoke about already, early intervention is really key, and evidence-based research will support that. And like you were talking about earlier, like having it in all settings. So when we do initial intake for a child, we identify, okay, what are we looking at? Are we looking at behavior management? Are we looking at communication training? Are we looking at social or peer interaction? We need to identify where the delay is initially, and also where the support is required. Sometimes it's in the home, sometimes it's in school, and particularly with behaviour management, we might initially start working with the child in the centre first, before then we try and generalise the programme to school and the home. So early intervention is key, so the younger the better. And like that, it's individualised again, so I can't say all kids need X amount of hours. That's not realistic. But going by my own guidelines from my licence, we wouldn't typically recommend less than 10 because it has to be repeated trials. It has to be not just a therapist working with the child. It has to be the mom or dad. If the nanny is looking after them, then the nanny needs to be trained. And we offer all that as part of ABA. We like to train our parents. We like to train our nannies, sometimes our siblings. We like to be in schools, because obviously schools, kids behave differently in schools than they do in home, so it's kind of good to see them across. We also like to collaborate with our other professionals, so if I have a child who's in OT or speech, then I'll definitely collaborate as well, because different behaviours or different program strategies might come in place that we can all come together and work. So I find that beneficial throughout my whole working career for that.
Thank you. Nicole and Nicola. I have to make sure that. Yeah, Nicola, many children are with autism have sensory issues. They are sensitive to light, to noise, to places, to transition. They don't like to go to certain places. And you are an occupational therapist. You probably see a lot of children with such behavior. Would you shed the light on what is sensory integration? I know it's your specialty and this is what you do. How can you elaborate? I'm sure a lot of people here would like to understand more about sensory issues, and what do you do to deal with them?
So sensory integration is used as a term for sensory integration theory and also sensory integration treatment. So as OTs, we look at the child's participation in all activities of their daily life. So how they can, with self-care, how they get dressed in the morning? Are they able to feed themselves at an age-appropriate level? We also look at how a child is able to access education, so how they perform in activities in the classroom, and we also look at how they are able to access play activities also. So that's looking at the child's gross motor skills, fine motor skills, attention and concentration, visual perception, and also their sensory integration abilities. So as you said, children with autism do present more commonly with sensory integration difficulties, and even now within the DSM criteria, it mentions hyposensitivity and hypersensitivity or reactivity. So basically a child with hyporeactivity means they are under-responsive to sensory information, and children who have hyperreactivity are oversensitive. So sensory integration in general is the ability to receive information from all our senses. So we've got the obvious senses, our visual system, auditory system, olfactory, taste and tactile, and we've also got vestibular system, which is around balance and being able to perceive kind of where our head is in space, and also proprioception, which is about body awareness and where our muscles are, and the tension within our muscles. So this is hugely affects our ability to plan movements. So that's praxis as well. So that's we take in the information from our senses, and then it's organized in the brain. And then sensory integration also refers to how we use this information to engage with our environment and people within our environment. So if there's an issue in any kind of part of the sensory integration, that can become a challenge for the child in many different environments. So what we do as occupational therapists, we look at the child's abilities as a whole, look at all their needs. So sensory integration is one part of that. So if we, normally within our assessment, we will screen their sensory integration abilities, and if there has been an issue identified, we may do a more in-depth assessment. Intervention, again, we always look at occupation and function, because as with most children, there's a huge range of what people can tolerate. Some people like intense sensations versus other people like more quiet environments. So what we kind of, our rule of thumb is that if the sensory integration issue is impacting on the child's ability to perform in their everyday life, then it's a problem and it needs to be addressed. So treatment normally involves, it depends again on the different sensory system, but say some of the ones that you've mentioned where it's sensitivity to light or sound, we'd work on desensitizing the child's sensation to it, and also then working on other strategies, so some self-regulation strategies too, so the child can cope better within different environments.
Thank you very much. Dr. Hiba, I'll come back to you, but this time I'm going to ask you a speech question. And a lot of children present with autism with speech delay, especially early, very early. In your experience, when it is the right time to refer to speech, and then what is the best practice when it comes to early intervention?
For children with autism in particular, of course, we can diagnose the autism as early age as it was mentioned. We start encouraging communication, not necessarily verbal, but at least some sort of communication with the environment, with parents. There are so many approaches that we use: a verbal behavioral approach or ABA. It doesn't matter. It's whatever the child is perceptive and the parents are comfortable to use at home. We start just, the aim is communication. So whether the child can verbally use the sounds or sounds like words or whatever according to the age, or maybe sometimes if there's more level of frustration of not producing the sounds or the words, maybe you can go with the sign language as well. So we encourage as early as possible, because the aim is to make the child able to see the environments, understand, perceive what's going on in the environments. I know the behavioral issue is part of it, and we have to deal with the behavioral issue sometimes before even to start introducing the verbal issue. But as early as possible, we start communication.
Thank you very much. We would like to take some questions from the audience. So if any of you have any question for Dr. Fiona, clinical psychology, or Dr. Sassane Masih, or for our Dr. Heba, the speech and language expert, occupational therapy expert, or behavioral expert, the floor is open for questions. Can we pass the microphone, please, Roshan?
Or human rights issue.
Or human rights, exactly, and legal laws. That's the good time to ask.
Hi, I'm working for a nursery. I just wanted to ask, what would you think of, we've obviously, you say in the young ages is when you should actually have early intervention. What value do you place on a tool that a nursery would use, for example, something like an ASQ tool, the ASQ questionnaire? Is there value in us doing something like that? Or because some parents just can't afford for us to say, well, we think there's a problem. Money does come into it for parents to seek help. So what is the value in a questionnaire like an ASQ?
I think questionnaires like the ASQ are really good screening measures. So they're very good for kind of helping us to identify. So as professionals in working in a nursery, you may be working with a child and you can see that there are some difficulties. Sometimes it's quite difficult for parents to identify those difficulties as well. So things like the ASQ are really helpful because they offer a bit of weight to support what you're saying to parents. And I think that it can help identify some strengths and some difficulties. Obviously, it's not a diagnostic tool, so it wouldn't kind of fill that criteria, if that makes sense. But I think it's definitely valuable, and it's certainly as a professional who works in a diagnostic service, for us to receive a referral from a nursery that has an ASQ attached to it is amazing. It's very rare that we would get something like that, but it kind of sets the groundwork for helping parents to see in a very concrete way that there are some difficulties that need support. And I think if you are working with a family who wouldn't be able to access professional services for any reason, the ASQ will give you guidelines for where exactly the difficulties are, and will allow you to start putting some support in place that's targeted to the areas that have been identified on the screening tool. So definitely, that's really good.
If we look at the system in Dubai, I think what we're trying to work on is to establish multi-layers of catchments. Children will go or be seen by many different professionals, starting with the pediatrician, the family physician, the nursery teacher, even the family themselves sometimes catch some symptoms and some signs for the child. The more layers I think we have, the better the catchment of these children that might have some delay. So the ASQ, and if we talk about autism, maybe the MCHAT, all of these are necessary tools for professionals who see children on a regular basis. The primary healthcare centers, government of Dubai is working on developing the skills of primary healthcare physicians to implement the ASQ and the MCHAT in the regular visits of the children to the baby checkups and vaccinations. So I think these tools are very helpful, and if the nurseries and primary schools can be trained to do these kind of screening, I think that would be very helpful for the families.
what we've started to do recently as well is go into a lot of nurseries and schools and offer training for teachers, parents, teaching assistants to even be aware of some of the red flags or some of the behaviour management strategies that you could use, particularly in a nursery setting. So we are trying to reach out to kind of educate people more, offer kind of parent training through that as well. So we'd be more than happy to assist in your nursery if that's something you'd like to do as well. Yeah.
I think it's quite helpful to think about services as kind of a tiered system, and nurseries are often that first tier that children will see. So there's usually quite a long process before they actually get to a more specialist service like a diagnostic service or an ABA service. And so that first tier of support that comes from nurseries and primary healthcare is really, really important. So definitely using screening measures is critical.
Download and print out.
Is it MChat? MChat, yeah. MChat. All right, thank you.
Hi, my name is Jihan Rabbit. I'm a clinical psychologist, and I have two questions, one too short, the other one more elaborated. So the too short one is about the website, about the law. If you can just please give us the website so that we can just refer to it when we need it. The second question is about the parent abuses. So we know that when parents are facing some disease with their children, sometimes we face some abuses by the parent. They became aggressive because of the disease of the children. And sometimes when we face this kind of problem, of course, we try to handle it with giving orientation to the parent and try to just help them, to find a good issue for the children. But if the problem persists, what is programmed by the law to just keep the children safe? This is my question. Thank you.
Yeah. Let me say something first. Parents, when they are frustrated, and having a child with disabilities is really frustrating. I think they lack the tool of how to deal with the children, and this is where the role of professionals to teach the parents how to deal with their children, and not to increase their frustration and not to increase parents' frustration as well. So there is so many ways, and maybe psychologists can help that. Once this awareness there, it's really easy to deal with the situation that they are in. In some cases, it becomes very extreme, and there is kind of abuse. And I think if professionals like school teachers in nurseries or even in the streets, if they suspect an abuse, it's by law they have to report it, and there is channels to report that. They can report it. There is hotlines, and they can go to the Ministry of Development Authority, or of our authority, Ministry of
Development and
yes. These.
Can you repeat it?
It's Community Development Authority. We have the Human Rights and Complaints and Monitoring Departments, and they can go and make a complaint. They can go to the websites, and there is all the channels where they can access and make the complaint. And then we have our process to investigate that. This is mandated by law. Let me tell you a story that I saw, and it was like a split of a second of how to make a decision. I was in the elevator, and this lady had a child on the crib, and the child, I don't know, he held something. It was like a year and a half. He held something, put it in his mouth. So the mother just took the toy, and she just did like this. And I was like looking, the door of the elevator just opened, and she went out. I didn't know what to do really. Shall I go and talk to her or come back? And then she left. I didn't do anything, but I regret it until this day. I haven't even at least went to her and said, what did you do? It's mandated by law that we have to report these incidents. So this is answering your question. For the law, I have a copy of it, so if you want to distribute it later, you just type law number 2 for protection of people with disabilities, and you will find it. It's there, accessible. Yes.
Keep in mind, there are 3 laws to need to keep in mind. There is the Federal Government Law 29/2006. This is the federal level which applies to all the Emirates, and that's for the rights of people with disability. In it outlines all the rights of people with disability concerning health and rehabilitation, education, leisure activities, accessible environment, and it's very comprehensive. That's one law. Law number 2 is Law number 2, 2013, which is a local law, meaning it's only in Dubai, and that's also for the protection of rights of people with disability. Then you have the 3rd law, which is child protection law, which is called Wadima law, concerning the case that happened a few years ago of the child that was killed by her parents. And that's very specific law for child protection, whether with disability or without disability. The only frustrating part about these 3 laws is that the bylaws for it has not been published yet. So the child protection law and the Dubai local law number 2, 2013, the bylaw is still under revision. The bylaw is very important. In it details all the, and Dr. Hiba is the expert in that, all the procedures, all the penalties, and the lines of communication, all of that is detailed in the bylaw. And from the bylaw, people or organizations and institutions can develop their own principles and guidelines for protecting the children in their institution or schools, and also make it very clear how to communicate or report any of these cases.
Thank you. Thank you very much. We did receive one question on the screen. It says, how important is a multidisciplinary approach to intervention provision for children on the autism spectrum? I'll ask Nicole if you can answer this question, please.
Well, I kind of touched on that earlier when I was saying about collaborating with our colleagues. So like that, if I have a child who needs some extra requirements in speech or OT or needs a referral for psychology, then we will work together. We work together with the families, we'll work together with the particular setting. So it is important, and we're lucky in the centres that we have. We're lucky in the centres that we have that we have everybody on site. So it's really, really good. Yeah, exactly. And not all centres are fortunate to have that and to have people with so much experience. So it's really important. It's nice for everybody to be consistent on the same page, and it reassures the parents a lot as well, and builds up a positive relationship. So then when we do go into schools, it's a lot more accepting. So. Thank you.
Any other questions?
Yes.
Yes, please go ahead.
I'm Aparajita. First, let me thank all of you. It's a very eye-opening session. And I have 2 questions. Since I work with kids, like from age 4 to 10 and 11, sometimes kids come and they say that, ma'am, there is a lot of pressure from the parents to excel in academics, especially when they get their papers after the assessment. So the class assessment or any kind of formal assessment. And they come, I ask them, what kind of pressure? Ma'am, they shout at us, sometimes they beat us also. And then immediately I take, okay, let's go to our supervisor, talk to them, I'll talk to your parents. Then they immediately withdraw themselves. They get scared. They do not want their parents to be exposed. They also feel, though they are small, they feel that, no, my parents will will feel very down, very low, because they are scolding or they are beating so that we become successful in life. For our good, they are doing it. We do not want to expose them. And it's okay, ma'am, don't call our parents. We don't want to let them down. So in that case, my question is that what is there in the law so that we can train these children how they can voice their problems? You know, there is majority of the students, majority of the pupils, so they are going under pressure from the parents that
yes. I'm laughing because a lot of schools don't have this anymore. Most of the kids are very vocal now towards their parents.
Okay.
But I'm sure someone here would like to answer this question. Hiba, do you like to answer that?
There is a difference between, it's in our culture that sometimes we spank our children. So like a spanking like this, I don't think this is an abuse. But if it's continued to pressure the child and really affect their psychological well-being, this is maybe a mental abuse or emotional abuse. And maybe there are some measures the teacher can take, maybe educate the parents, talk to them, and I don't know, there are so many ways that teachers know how to deal with that. But if really this is from the teacher perspective, thinks that this is really affecting the child, I would say exercise the law. And you talk to the parents directly, this is what we see, and this might affect the child. We suggest that let's work together to find ways and tools and ways that we can ease the pressure on both of you. Otherwise, it might not be okay later on, and we need to take other measures because it's very hard. Doctor, you want to add?
If I may add, I think it's important to recognize the emotional aspect or emotional role in education. A lot of parents don't take that into consideration in the sense that they just want performance and ignore the emotional stability of the child during education. So I think the schools I would see them as responsible to educate the parents about the role of emotional support for the better performance of the children academically. That's one. Secondly, I think if these kind of incidences are culturally accepted sometimes, we need to take initiatives. So schools need to take initiatives to train the parents or educate the parents about other ways of show support or encouragement for the performance of their children.
I'll just add a little bit. We've seen a lot of children, especially those with learning difficulty and those who are missed for a few years, like until they are 11 or 10 when they are discovered to have ADD or attention deficit, if they have learning difficulty or dyslexia. A lot of the diagnosis happen later. It doesn't happen early. They skip because they are okay when it's kindergarten and early years. And parents' expectations are usually very high. They set very high expectations. And the parents become very frustrated when they see the child is not performing. And I have patients who come and complain that their children are not doing well. And I tell her, but your child have needs. You have to respect the capacity, the abilities. The child cannot perform better. But they push and push and push because they cannot accept. So the problem is in the parent themselves. They are not accepting that their child is having difficulties. They think by pushing they can get over it. They don't realize that the child needs maybe the parent himself or herself needs psychotherapy or some counseling in order to get more to accept. And once they accept, they can have a better relationship. This is what we have been seeing, and the problem is in acceptance. And we've seen also children who've been on behavioral therapy program for some time, and then the parent decide, okay, I want to try something else because they cannot accept that the child is having a problem or he's not performing or he's in autism. They still feel that there is a window to escape, and they try everything. Unfortunately, this is happening. I don't think any law can change that. It's part of us being human beings.
I think one thing families and institutions need to keep in mind concerning child protection laws in UAE, that there is a philosophy behind it. And the philosophy behind it is not to blame the family. It's more geared toward saving the integrity of the family. So even if there is some abuse in the family, the child protection service providers, their main goal is try to keep the integrity of the family together. So they try to help the family, the parents, education, parent training programs before resorting to taking away the child. So this is not the approach or the philosophy of the child protection in UAE, is any abuse, we need to snatch the child out of the house and get the family in trouble. Actually, it's not. It's the opposite. It's try to help the family, because we realize that, you know, families are under pressure because of disability, because of other social pressures, that some support, some understanding, and some education and awareness can do a lot of difference in these cases.
So is it okay also to bring the awareness among the students by telling the laws or the rights?
Well, you have a whole program.
Yeah, we have a big program also in for educating children about human rights, their rights, and we have finished like last year. The program really educated about 5,000 children in the Emirates of Dubai. I don't know the details of the program, but there is a toolkit, there is a training tool that they use. They train the teacher of how to educate children through play and through activities, how to know their rights, how to protect themselves. Also, there is a very nice application. You can all download it. It's called My Rights. You can find it in Apple Play. I wish I brought some of the toys next time, inshallah. But at Google, at Apple Store or Google Play, it's called the Android. I don't know. I'm an Apple person. It's called My Rights. And it teaches through a game the child's rights. It's very nice, even for parents. They can play. It's very nice. Okay. So download the game, and this is part of the activities that we are doing. There is more. I'm not really. This is another department for the human rights. It's the awareness and studies. But this is what they are doing. And if your school wants to have these programs, awareness programs, please contact the Community Development Authority. We'll be happy to arrange that with you. Thank you so much, ma'am.
Thank you. I have a question here we just received online. It says psychologists often recommend many therapies for children with autism, but what route should a parent go to first, as they can only afford one?
It's a difficult question. I mean, I suppose the most difficult thing about it is that there is no one catch-all therapy that's going to help every child on the autistic spectrum. So it depends on the particular needs of that child. So I think one of the first things that I say to parents is that any therapy that you should be accessing for your child needs to be evidence-based. So there is a lot of things that are recommended for children that have no evidence behind them, and parents will spend a lot of time, a lot of money, and a lot of their emotional resources in these interventions that are not going to yield the results that they want. There is no cure for autism. It's not a disease that we're trying to eradicate. It's about teaching children skills. And so I think there is no way of answering the question to say this is the therapy to start with. What you would need is that hopefully that child has had a good multidisciplinary diagnostic assessment. So an assessment for autism, it should never really be done by one professional. It should be a team of professionals, and not just a team of professionals in a centre like ours, not just a speech therapy psychologist, but involving schools, involving parents. So everybody's part of that diagnostic team. And as part of that assessment, what we would find at the end of that assessment is exactly where that child's strengths and difficulties lie. And at that point, we're able to then advise about this would be the best therapy to start with for your child. So for example, if we're diagnosing a child who is on the autistic spectrum, has significant speech and language delay, so we can see they need SLT, there's no doubt, but they're incredibly behavioural. They're not going to benefit from speech therapy as the first port of call, because that speech session, or those multiple sessions a week, will be spent managing the behaviour, not doing speech therapy. So for that child, we might be saying actually a behavioural intervention is the first port of call before transferring to a speech intervention. But if we're working with a child who actually doesn't have significant behaviours, is doing very well, but their difficulties, so for example, if we've got a 7-year-old who historically might have been diagnosed with Asperger's, but obviously now we've got different terminology, who's actually pretty high functioning, but they're really struggling with their social communication, their pragmatic language, then we would be saying actually speech is the therapy that we want to focus on. So it's very individual, which I suppose is not, I'm not really answering the question, but that's my answer, is that it would very much depend on the child.
Can I add something from my practice? Usually we see all sorts of children with disabilities. I practiced for like almost 12 years in the clinic in King Faisal, and I always parents, they go to like rehabilitation centers and they have training for their children with the therapist. I always tell the parents there is two things you have to be aware of after 6 weeks. First of all, once the child is diagnosed, there must be goals that is really clear, that is communicated to the parents, to you, so you know what the therapist will work on and what are the goals. This is very important. Even if the parents is not very educated, I come from Saudi Arabia, so some of the parents really come from villages. They're simple people. So I say, therapist should sit with the child, and no matter what approach that she's using or he's using, they should communicate these are the goals that we're going to work with the child, and make sure that you have that. The second thing, after 6 weeks, if you don't see improvement, that means there's something wrong. The therapist that's not doing something, or maybe she's doing it solo, not engaging the parents in it. Also, the third thing, they have to have goals that they can be applied at home. This is the simplest way of explaining it to the teacher to make sure that they are going in the right direction. So.
Well, we have a lot of questions now. We have to really speed up a little bit. What provision is there for parents who cannot afford going to diagnostic session and therapeutic session, which are a cost? Again, there is good news today. We have insurance coverage, thanks God. Now they are starting to cover the basic requirement for autism. So I think this could be something that would help some children. Unfortunately, autism comes with a package with a cost because of the amount of interventions and therapies. But the government does have a program for the local community, the early intervention program.
Well, I think the cost of autism or any kind of disability is quite high for any family, and there have been many suggestions of solutions to how to assist families in covering or coming up with the cost. Insurance obviously is one of them, but that's more of a medical insurance that the medical authority is responsible for, and CDA has established communication and collaborative work in developing some sort of a scheme for covering some of these interventions for people with disability. I think the insurance is the way to go in the future, very near future, but I think there's also other possibilities of subsidizing some services, for example, families through the government, and also the CSR. As you all may be aware, the CSR law has been passed a couple of days ago, where a lot of companies are able to kind of contribute to the social causes, and a lot of services, especially from the government, we see that a lot of help can be done by companies and establishments to support and some children or some cases that need services on a long term. So I think it's a multitude of solutions rather than just one solution in that case. And also a lot of times we see charitable organizations kind of contributing and helping some cases that might be very difficult for them to cover any of the costs. So we're hoping that the insurance scheme kind of work well, and with that I think there are a lot of services going to be covered, including the assessment and the intervention.
I have another question here. Is my child was pushed out of school by school counselor because the report submitted mentioned autism. She mentioned here it was done in 2009. We're not going to go through this, but just to answer her, today the KHDA have published their inclusion strategy, and there are requirements for schools today to build their inclusion system. We will be covering this topic in detail in our next Let's Connect Professional, which will be held in March. So we're not going through this conversation at the moment. It's not we're here talking about early intervention. Our guest experts are experts in what we need to do when, and we're taking all these questions to help out parents who have very young children and they want to know more, and doctors who want to refer also children because they see that they have some developmental delays and they want to know what to do. There's another interesting question. It says, and what do you think about the intervention of the children with severe and multiple disability or comorbidities, I believe? And the question again, at what age for labeling them as severe and multiple disability? I'll give you this, Fiona. I think this is something that you...
when we're thinking about kind of severe and profound disabilities, so what we tend to do when we're thinking about child development is up until the age of 6, we refer to global developmental delay. So that's the when a child has delays in all areas of their development: cognitive, speech, motor, adaptive, social, and we would refer to global developmental delay. When a child reaches about the age of 6, the DSM-5 criteria is very clear that we then transfer that diagnosis, that if they continue to meet those criteria, that we would then be considering whether or not they present with an intellectual disability. So at that point, we're looking at cognitive skills that would be below the level of 70 on the kind of IQ scales, and deficits in adaptive function in addition to IQ. So that's where we would kind of classify somebody as having an intellectual disability. When we're thinking about profound and multiple disabilities, we're thinking about the young people who have the most significant level of those difficulties. So that's kind of when we're diagnosing. The next bit.
I don't know if the question came from somebody in the room or from outside, but if this is okay with you, yeah. All right.
Yeah.
We have one more question here.
Can I add something? I want to mention something about labeling. Labeling actually is just to receive services. So, in my opinion, that we should not be stuck into labeling that much for the children, strengths and weaknesses and all of that. This is more important. But in terms of labeling, we just finished last year the National Classification for Disabilities. That is nationwide. It's on the federal levels, and it was approved. That classifies people with disabilities in UAE into 4 categories. It's kind of goes with the DSM-I. It's the classification is very important just to go later on and go into the services and the eligibility of services in schools or in rehabilitation centers, and maybe later on it can be connected to the insurance and what services that the children can benefit from the insurance. So this is, and also I think the classifications, I think it's in the ministry website, it's over there, so if you want to take a look at it.
I'd also like to add that CDA provides a card, a disability card, Senate card, that makes the child or the person holding that card eligible for a lot of services, kind of discounts, priority services, and things like that. And I think it's important for you as a service provider to kind of inform the families that these kind of services are available on Dubai level and even on a federal level, that a person with disability can hold a card that help them. It's just not a labeling, but it's just a service and helping them in a lot of priority services for them.
Yeah, like in some German hospital, they receive 50% off services.
So some of the services are good.
Yeah.
Any other questions? We have one more question here. If a child is diagnosed with autism and is having intervention, how often should he get reassessed to ensure that the intervention is making improvement?
That's me again. Well, I suppose the question has two parts, really. In terms of, I suppose we want to think about formal reassessment and ongoing assessment while we're working with a child. So any child who's having intervention services, as I mentioned earlier, assessment is a dynamic process. We should be constantly measuring that child's performance, looking for progress. So certainly in ABA, you guys collect a whole world of data constantly about the child's progress, and so we shouldn't really be waiting to look after a certain period of time. Is there progress? We want to constantly be evaluating that to look for progress, because what you guys, I'm speaking for you now, Nicole, but what you guys will be doing in ABA is constantly moving the programs on. So if a child's mastered a skill, you want to progress on, and so you want to kind of measure the progress consistently. But on the other side, if they're not making the progress, then there needs to be some changes to the way that the interventions are being delivered. If we're thinking about standardized assessments, the kind of golden rule is that standardized assessments can usually be re-administered every 12 months, but it's not always essential to re-administer every 12 months. So if you've had a child who's had a full diagnostic assessment, they don't necessarily need it again 12 months later. So usually there will be particular standards that are set perhaps by education authorities, so KHDA, like a two-year annual re-evaluation. But it also depends on the age of a child. So if you've assessed a child who's 2 years old, waiting 2 years is a lot of their life to look, to wait and to reassess. So you might want to do it more frequently when they're younger. But really, the kind of standardized assessments that are being redone every year or every 2 years are part of the process. It's the constant process of assessment and evaluating progress that's the most important thing.
Thank you. I had a conversation a few days back with Dr. Hassan about some people offering practices and solutions to families who are very desperate to cure their kids. And a lot of these solutions are not documented, are not valid, are not researched. I would like to, Dr. Hassan, to shed the light on your experience of, number one, why parents, we understand why parents go for these solutions because they want a quick fix. But what is your advice to take? Because a lot of people leave valid therapy to go to these therapies which are supposed to be short term, but they don't get anywhere with them.
I always like to share this story of a father's experience of the desperate feeling that they had concerning finding a solution for their child. He literally told me, he said, I climbed Atlas Mountain in Morocco, hand and feet, to reach a guy on top of a mountain because they told me he can provide me some solution. Parents go to that level of desperation to help their children. So I think it's very important for us as professionals to kind of clarify to parents and family what is documented and research-based and scientifically supported, and from the services or practices that has no support and no evidence in the literature. After that conversation, I kind of made a little search concerning what are these practices, and if you get onto CDC website and the American Academy of Neurology and the American Child Neurology Society and the American Academy of Pediatrics, they usually list what is recommended as a practice of intervention and what is not recommended, and you find kind of a lot of different kinds of alternative interventions that are not supported, and I made a list here. I'll read some of them that are not. All of that has either no research support, or if there has been a study on these approaches, it wasn't conclusive or it didn't support the approach, except one alternative intervention that is showing promises, and I will mention which one. But an example of these alternative interventions, the antiviral treatment, antifungal treatments, all of you know chelation, secretin intervention, yeast-free diet, gluten-free diet, vitamin B6, vitamin C, magnesium diet, dimethyl, can't even read that, omega-3 intervention, auditory integration, behavioral optometry, craniosacral manipulation, dolphin intervention. All of these have no support, either the study didn't support the intervention or there are no studies done on these interventions, except for one that's showing promises, which is surprisingly, I was kind of surprised by that, music therapy. Music therapy has shown some promises, and it improved the social communication aspect in children with autism. And the other one that has mixed reviews is the immunoglobulin intervention that has some studies that shows that it works and some studies shows no conclusive evidence. So these information are available, and I think as centers, interventionists, physicians, you need to be abreast of what is the latest in the community. I mean, there are some places in, I don't want to mention where, but they have oxygen chambers. Actually, that's dangerous. Okay, that's dangerous. Some of these interventions, chelation has caused 2 deaths. Okay, in the literature, oxygen treatment has created seizure problems. So we need to be careful. Some of these are dangerous. Not like they don't help, but some of them are dangerous. So you need to inform the family what kind of services they seek.
Well, no more questions, I believe. Oh my gosh. You don't want to have dinner? Okay, we'll take 2. So we will take the gentleman, please. Yes.
Can you all hear me?
Yes.
So I'm Hi, I'm Aman Sohal. I'm one of the consultant pediatric neurologists. And I must say I was about to miss this talk, and I was going to regret it. I'm so glad I came.
Thank you.
I had lots of questions, and many of them have already been answered. So thank you very much. So I have a brief comment, actually. So number one, about the therapies you were talking about. Recently, I had a parent who came up to me and said, recently we heard about ketogenic diet for autism. So that's something to be rebuked as well, which is, there's no evidence behind it. Secondly, lots of children who have problems in terms of behavior, speech and language, or they are on the autistic spectrum disorder. They come from the school, or they come to see us from the interventionists, who all play a very important part in the progress of the child. My only comment is that because we have seen lots of children who are referred to us late in pediatric neurology and they have underlying problems. We mustn't forget that there will be a group of children who will have underlying problems which can be dealt by, yes, we need intervention, but the diagnosis is also very important. So it's just a brief comment that do not forget that these children may have some metabolic problems underlying which needs to be looked at. Thank you.
Thank you. The next question, yes.
My question is for the development. My question is, can community development help in aiding financial support for orthotics and prosthetics devices, mobility equipment, adaptive equipment like activity chair or bat chairs, or AAC for those family or kids who cannot afford? And what is the process?
I don't know why I put my glasses on.
Yeah.
But force of habit. Concerning benefits for families who have children with disability, there are some benefits available in the Community Development Authority, and there are criteria you have to get there. But we need to distinguish between 2 different kind of devices. There are medical devices and there are assistive devices. Assistive devices are not covered under insurance or any kind of benefits, but medical equipments are covered through Saada insurance and some medical insurances. And the Community Development Authority benefit sector provides some support through financial aid for these equipments. But families need to be aware that what kind of equipment they are asking for. It has to be medical. If it's assistive, it's not under the medical equipment, it's not covered, which creates a problem sometimes, because some people, recently we had a case of a gentleman needing a braille. It's considered non-medical, so we couldn't help them.
Can I do a follow-through regarding braille?
Okay, at the end of this session, I would like to ask Nicole to give a statement at the end to just conclude what you advise to our professionals here today when it comes to early intervention practice and behavioral intervention.
So, like I was speaking to the lady earlier who works in the nursery, those are going to be one of the important people to kind of identify where the red flags are, because like that, kids act differently in school than they do at home. Parents don't necessarily see the behaviours or the lack of social peer interaction that they might miss out in school. And I think teachers are quite important in the early intervention to kind of identify those factors. And I think they're more objective, because as a parent, it's very hard to be objective when it comes to your own kid. It's like, no, he's grand, he's fine, he'll grow out of it. But you need somebody subjective to kind of say, "This, I do have a concern. I see this happening every day in nursery. I see this happening in the playground." So I think like your eyes and ears are really, really important going forward for early intervention. And like that, here in the centre, we're trying to do our best to educate as much nurseries as possible, because at the end of the day, parents trust you. You're the first protocol. You're there with their kids every day. We're just strangers coming in. They don't know us. So like we have to get on board together if we're going to like work together to help parents.
Thank you very much, Nicola. Nicola, what be your last words to people in the room regarding best intervention when it comes to occupation therapy?
Okay, yes. So going back to what Nicole has just said as well about making observations at school and parents at home, just to also be aware of if something is being observed as a behaviour or the child is not wanting to participate, that many children with autism have a lot of difficulty with praxis. So that's being able to know how to participate. So often it's observed as challenging behaviour and that the child is just not wanting to. But OT, we look a lot on assessing praxis, and we can help with support and advising, saying yes, this is actually a praxis issue, or again a sensory integration issue that the child is having a lot of difficulty even just paying attention to your instruction. So just to be aware when you're looking at a child, if they are not performing, that these underlying problems could be involved. So if you would like a consultation with ourselves, or even if you want to call and perhaps describe what you're seeing, then we can advise on whether or not an assessment is warranted. Okay, thanks very much.
Dr. Heba, thank you very much. I know that you're now in the human right and in the speech side, so I'm going to ask you to conclude with both areas. So what do you think would be the advice you would give to all our pediatricians, psychologists, psychiatrists? We have a lot of professionals in the room when it comes to the children's rights, and as well when it comes to, I would say, the rights of people with determination, and when it comes to speech and language best practice approach.
Okay, I urge parents to be advocates, to act as advocates for the rights of their children. The law's there, the knowledge is there, to educate themselves and to know what's right for them and what's right for their children, and demand information from the professionals. This is your right to know everything and to demand information. So it makes life easier a little bit. In terms of speech, I think they covered most of it. I'm not practicing speech pathology for like 3-4 years now, but communication is very important. It's to start as soon as possible with the children, just to help him communicate in the environment and to express themselves as children. Also for the parents as well, to know what's the best way to deal with their children. This is very important.
Thank you. Dr. Hussain, I know you have a lot to say. You are an advocate yourself for the children with autism all over the United Arab Emirates. And what would be your words for our pediatrician in this room today, our psychologists, our psychiatrists, our occupational therapists, our teachers, the whole community of professionals here today?
I think what I would advocate for is mostly best practice. I think the literature is full of what is the best practice in dealing with cases of autism, concerning what is the best practice in assessment, in intervention, but also we notice a lot in the market that a lot of physicians and professionals, knowingly or unknowingly, they do a lot of evaluation that are not necessary. For example, EEGs or neuroimaging, they're not indicated for cases of autism unless there are certain signs and symptoms that will indicate these kind of diagnostic services. So follow best practices in these cases, and with that comes the best outcome. I guess what we all want is the best outcome for these children and their families. So following these best practices in all areas of evaluation, assessment, and intervention, and family support, I think that will get the best outcome for the families.
Thank you very much. Dr. Fiona, your last words.
I suppose my kind of parting message would be that this is a networking event for professionals, and so we're all here with the same aim. We want to work together, and I think that we tend to work very well with our colleagues within our centres, but we have a lot of expertise and skill across the UAE, and I think it's really important that we don't just work multidisciplinary in our centre, but we work multi-agency, and so we should be working together, referring together, sharing our knowledge, sharing our experience. There is no one person who can do everything. We should not be trying to assess as individuals or do interventions as individuals. We need to use the team, and we are all one team because we're all working towards the same end goal, which is supporting children and supporting our families. So that's my parting message.
Well, I would like to express my thanks for you to take the time off today and come and be with us. We have enjoyed this session. I hope you did enjoy it as much as we did. I would like to thank our panel. I would like to thank Dr. Hussain Masih and present this plaque. Dima, can you please help me? Yes, thank you very much. Big claps, please. Thank you. Nicola O'Reilly. Dr. Hibati. And we have Dr. Fiona. She's there. Thank you. And Miss Nicole. We'll say it right now.